May is Mental Health Awareness Month. I'm Lisa Jackson with Carpe Diem Wellness. And is there anyone who's not aware of the declining mental health we've had in this country, particularly the last few years? So today I want to discuss with you some simple solutions that can make or break your mood for this month of May for Mental Health Awareness Month. I want to discuss specifically how what you eat matters. I wrote my book, Savvy Secrets, Eat, Think, and Thrive, 7 Steps to Optimal Health and Wellness. And today I just want to focus on you are what you eat. So I want to ask you first, do you crave caffeine, sugar, carbs, or alcohol? And if so, what does this have to do with your mood? Caffeine, sugar, carbs, and alcohol all raise your blood glucose level, the sugar in your bloodstream, and glucose raises the hormone insulin, which opens up the cells to receive the glucose, which causes a later resultant crash in blood sugar, which raises cortisol, the stress hormone, in response. So this can create a vicious cycle that you may be well familiar with. Coffee and pastry for morning, for that breakfast, for that instant energy, or your coffee with just cream and sugar, followed by a crash, maybe a little hangry or crankiness 2 hours later, needing another cup of coffee or another quick fix. And this, of course, can exacerbate mood swings from high to low, from anxiety to depression. So you may be craving sugar, empty processed carbs, or alcohol to self-soothe or to self-medicate, but it only perpetuates the problems. And you may be interested in looking at my previous post on when habits become addictions and why that is and why it happens, what it does physiologically in the body. But I want to talk today about depression. And you may have heard of seasonal affective disorder is the result of low vitamin D. Low vitamin D is also seen in all autoimmune disease and cancers too. But did you know that magnesium is needed for the conversion of vitamin D in the body? And what lowers magnesium? You guessed it, sugar, alcohol, empty carbs, and stress. And what else interferes with the conversion of vitamin D? High fructose corn syrup. It's that very cheap, super palatable ingredient in most processed foods that we call empty carbohydrates. Food that has little to no nutritional value and is made to be addictive. So are you having trouble kicking the sugar blues? Is your addiction really strong? You may have also, on top of this, an overgrowth of Candida albicans in the gastrointestinal tract that's contributing to intense cravings. You literally have bugs in the gut crying, feed me, feed me, feed me. And of course, they are insatiable. So the more you feed them, the more they want. Other signs of Candida overgrowth may be skin issues like eczema, dandruff, maybe chronic vaginal or chronic urinary tract infections. And again, what feeds Candida? Sugar, carbs, and alcohol. So speaking of skin, sugar is a common cause of acne. And many teenagers decide to go on the birth control pill to control the acne, which of course doesn't treat the root cause of the problem, but it only makes matters worse. Birth control pills completely disrupt your hormones and create greater stress in so many ways. Topic for another blog post. But a very common side effect of birth control pills is anxiety and depression. So what commonly occurs? Young women are then put on antidepressants or anti-anxiety pills or pills for insomnia. And why does this happen? Medications including birth control pills, all have side effects, and they all have deplete the body of certain vitamins and nutrients. Many often do. And in the case of birth control pills, they deplete your body of vitamin B6, which is needed to make your neurotransmitters, the hormones, the chemicals that are made in the gut, which include serotonin, dopamine, and melatonin. And these are the neurotransmitters, the chemical messengers that you need to feel good, to focus, and to sleep. So is it no wonder that we don't have this epidemic of anxiety, depression, ADHD, and insomnia? These are modern day problems. Vitamin B6 is also needed to make taurine, which is to make taurine active and effective. That it's very important for your amino acids and your protein metabolism. And taurine is needed for so many things, but it's needed in the gut for the gallbladder to secrete bile. And bile is needed to break down your fats and assimilate your fat-soluble vitamins, including vitamin D. So sugar, alcohol, and carbohydrates also deplete your body of chromium, which is needed to balance blood sugar, and selenium, which is needed for your thyroid and good cellular metabolism. And these are all common mineral deficiencies found in depression and anxiety. There are also common deficiencies found in obesity, diabetes, cardiovascular disease, and infertility. Do you see now how everything is interrelated? How all health begins in the gut, and it begins with, what are you feeding yourself? Food is information, and it can lead to optimal health, or it can lead to disease, particularly mental health diseases. So what can you do? If you have these symptoms, you can you can do, actually the simplest thing is my 21-day kickstart. It's a do-it-yourself program. If you're motivated, just sign up. You get daily emails and a little 5 minutes, simple solutions on how to address these sugar blues and stress busters, on why sugar is inflammatory, what to do about it, recipes, because food is meant to be delicious and decadent. So it's not about dieting, it's not about deprivation, it's about replacing these with healthy fats and proteins and food that is delicious and is not going to raise your blood sugar like empty carbs. Stay tuned. Next week, we're going to talk about how we think affects our mental health. I hope this is helpful. Carpe diem means seize the day. We only have this day and this moment to make a difference. And what we do today will determine how you feel tomorrow. Have a fantastic day.